One of the most important skills I teach my clients is how to manage pressure and appropriately use your abdominal muscles to support your pelvic floor and your lower back when you're training. One of the easiest ways I have found to teach this is by using a straw. So I'm going to demonstrate a couple different ways that people often do this, and then I'll teach you the right way to do it. So if you take a straw, put a hand on your lower stomach. I'm just going to hold this like this so you can see what my stomach is doing. And take a big inhale and then exhale through the straw and pay attention to what your lower belly does when you do this. Does it go out to push the air through the straw, or pull in and up to push the air out of the straw? Know if you are pushing out, that is mismanagement of pressure. You are pushing the air down into your stomach cavity, and while yes, that does support the lower back by increasing the pressure in this lower abdominal region, it doesn't effectively support your lower back by using your core muscles, which is what I would like to teach you to do. So if when you exhale, your stomach goes out, next time you do this, imagine your belly button going in and up. There shouldn't be any change in the position of your lower back. It should all be this muscle right here. This is called your transverse abdominis, and it's a very, very important muscle when learning how to manage pressure and appropriately engage your core when you are training. And not only is it important for your pelvic floor, but it's also important for support of your lower back if you have any lower back pain. It also forces you to keep your spine in a neutral position when you're training, which is very important because it's the right way to do it. So take a big inhale. Think about inhaling out into your rib cage. And then when you exhale, lift this muscle. Imagine it's like a triangle right here. This muscle lifts up and back towards your spine without the position of your lower back changing. So take a big inhale, laterally into your rib cage, and then on your exhale, lift up and in. You see how this part of my stomach comes up, not only back, we're not sucking in, we're lifting and bracing inward. You can also do this laying on your back. You might be able to envision it a little bit easier, or do this just when you're practicing. So on your back, take a big inhale, laterally into your rib cage, exhale, up and in, and you hear that shushing breath. That engages your abdominal muscles in order to put you in the correct position to train from. So if you're doing it correctly, you are coming up and in. If you're feeling yourself press out, that is an incorrect management of pressure. We want to send the breath up into the lungs, into the rib cage, not down into your stomach.